Well, all right, let's talk about vaginas.
Let's do it.
Yeah.
Okay, so first things first, who is a great candidate? Who qualifies for this procedure?
I feel like several different people, lots of people are going to qualify. One of the biggest things we always see are going to be our patients that have just had a baby. After you have a baby, there's always some sort of trauma involved. Even if someone doesn't have a tear, even if someone's had a C-section, I mean, there's a baby that's been there putting pressure on the pelvis, damage to those ligaments. I mean, you've carried a baby around for 39, 40 weeks. And so there's a lot of pressure in the pelvis. So those patients can definitely benefit, especially if they're having some symptoms after. They can absolutely benefit from
So pretty much
procedure.
all the mamas.
All the mamas can definitely benefit.
Who else?
Stress urinary incontinence. So again, as we age, we have that urethra. I love the way Alice describes it. It's kind of like a king toes, and a little bit of urine will come out when you're not wanting it to, when you cough or sneeze. And that happens with natural aging. I see it a lot in athletes as well. And this will really help that collagen rebuild the anatomy of the urethra and improve your stress urinary incontinence.
So stress urinary incontinence, number 2. And so Bethany, tell us a little bit more to tie into what they're talking about. What kind of patients have been coming in the door and have been benefiting from this new treatment?
Yeah, so very similar to what they're saying. A lot of patients who have had childbirth, a lot of patients who, whenever they, jump on the trampoline or cough or laugh, they tend to urinate on themselves. And so this has been helping a lot with strengthening those pelvic floor muscles. Also those who've had vaginal atrophy from chemo or just from aging. People have been benefiting a lot from in those aspects.
I think everybody is a candidate for this. When you think about what happens to your body as you age, and also whenever you have a baby, your pelvic floor complex starts at your lower back, curves all the way around and inserts into your hip. And especially if you're a mom, you're carrying a baby on your hip, there's trauma from that. So you have literally almost every pelvic floor muscle is damaged, weakened, slowly trying to rebuild, and then you're putting additional weight on one or the other hip.
It's a quality of life issue as well, and a lot of us have been putting ourselves on the back burner for a long time. Like Lisa was saying, I mean, if you're not getting up all the time during the night, go to the bathroom, your sleep quality is going to be better, your life's going to be better. And these are things we tend to think of like, oh, it's not that big of a deal, it has to do with sexual health, so I'm going to just put it on the back burner, and I'm just, this is not a big deal for me because it's just dryness, or it's just this, or maybe I'll have to take a pill for it. But sometimes, I'm not anti-medicine, obviously, but sometimes those medicines have side effects, and if you could do something that didn't have a side effect, plus it could get you better lubrication, better orgasm, things like that, why would we not try that instead? I mean,